let's get some lotion on her. One thing, if you're a massage therapist watching this, you may not be able to see the fact that her whole right side is rotating forward a little bit. Now that's a lot of times, if you're dominant on that right side, it starts to pull forward. So what I like to do is, because we want to get through here strengthened so we can pull this back and then release her pectoral muscle too. Now for our clients, that just means, that's why a lot of therapists will ask if you want pec work done, at least a lot of good therapists. But because the pecs affected a lot too. So the first thing I'm going to do, you're just putting lotion on them a little bit. Get some blood flow moving. So one thing, as a client watching this, she has something in the middle of her back called a spine, and we don't want to put our elbow in there or our fist or our fingers, and hurt them. Now, what I do want to say though is, if you're the client receiving it, if your partner does hit you there, make sure you tell them before they start digging in harder. I like to say, I like to get next to the spine though. So if the spine's right here, you can push the tension away from the spine. But like I said, a lot of times if they're even having back pain back here, it's usually caused from internal rotation of pulling forward on that right side. So I'd usually give my clients some exercises to stretch out their pecs a little bit and to strengthen their back. A lot of clients make the mistake, and they're stretching their back, doing this stretch. And that's actually a really bad stretch for you, especially if you're constantly pulling your chest forward. You're just pulling on it more. Now, it feels good during the time, but it can cause some more issues. So if you're doing that, stop. So a lot of, like I said, her shoulder's rotating forward. So one of the things I like to do as a therapist is hit some areas that are common areas that some therapists just don't work on because they don't know or know how. But if you go under the shoulder blade, so here's her shoulder blade, a little triangle. I'm going to slide under. Don't dig into their rib, but I try to slide under with my thumb and come up under the shoulder blade. Our camera lady is Brittany. She's one of our receptionists here. Can you get a view on that? Or is it hard? You may need to come on the other side, but I like to walk my way under the shoulder blade. I'm not pressing in her rib. I'm pressing straight up under. And it can be a little tender, so don't press too hard. If they're ticklish, I might throw in a forearm because it's covers more area, so it's usually a little less sensitive. Just like that. Again, don't elbow them in the rib. Just slide up and under. Right where they feel the sensitive spots, you can always sit on that for a second. Get the muscle to release. That's called trigger point therapy. Definitely right here, I'm feeling one. You feeling that, Ashlyn? Yeah. She's like, I want to punch you right now. Trigger point therapy is also known as neuromuscular therapy. It's just a cooler word for it. So what happens is most of my clients that have this issue, I like to work this area before I even mess with this one, but I might start up here just because that's where everyone's hurting is through here. So I want them to see that I care, and I'm working on that. But I'm going to jump in here and work this area too. Next thing, I like to get on top of this shoulder blade. If you think of the shoulder blades like that, right on top. There's some little trigger points at the bottom corner. You can kind of press into, you know you're in the right spot when they tell you, ow. You know? Ooh, or when it throws you off. Good. All right. Now, a lot of people that even just have neck pain, I like to work all this first. Get the muscles to relax. Remember, I'm pushing, getting near the spine, not pressing on the spine, but pushing away for the neck. If you're a client watching this, definitely one of our male clients. This is a get out of jail free card, for your wife or girlfriend. If they're mad at you, just say, let me give you a massage. And just watch our tricks. So, again, you can get right up into this neck area. Brittany, make sure you get a good view. Here's your spine. I'm going to get right in here and just push through. A lot of therapists miss this area for some reason when they're doing face down work. So that feel pretty good? All right, next I like to do is a good little bit of a stretch. I'm going to pull her scapula like this. Try not to pull their hair though. And just pull and push. Get some of that tension off the neck. Now, one of the things that I've learned as a therapist is I don't like to just leave them in one spot as far as like where their arm is. I like to put their body in different positions because, yeah, if I release all this in this position, as long as she doesn't get out of that position, she's just going to be fine, but generally she's going to be moving around. So, I'm going to do a little stretch, interlock your elbows under, and do a good pull and lean back. Just don't pull their arm off. I know, my humor's not too great, but we'll do what we can. Thanks again for watching this YouTube video. We have many other great videos. But before, I'm going to do a couple more techniques. Usually, like I said, feels pretty good. You can just watch this and learn some techniques. I always try to... one of the things I also want to mention, definitely if it's clients working on each other, is I don't want you to push with the tip of your fingers. Use the pad under here, and then make sure you're leaning into stuff. You got to use your body mechanics. Last thing over here. And if you're a therapist watching this, I'll show you a bonus one that I really like to do. If you're a client, the next one, I don't want y'all to try the next one because I don't want any mistakes, and then I'd be blamed. So just kind of working some of this out. One thing I like to do is, as I said, her right shoulder tends to rotate forward. So I'm going to come on this side. I'm going to keep my camera crew on this other side because I'm going to lift up here, push her shoulder blade down, lift up and have her push down. And relax. But lift up, push down, and relax. Lift up and push down. Relax. Good. Really good for the shoulders. Really good for the alignment. As I mentioned, the next thing is for our therapist. I like to hold their hand, put my hand under their forearm, come in between the shoulder blade with my forearm, kind of guide my forearm through while rotating the shoulder. Don't do this if they have an impingement or if they have any uncomfortabilities. If they do have an impingement and you don't know how to work on that, comment below and I'll do a video for it. I think there is a video we have for it, but if not, I'll do another one. And for clients to know, I always say there's a good pain and then there's a back off of me pain. It should feel pretty good, with a little bit of pain, but not to the point where you feel like, that you may make it worse. All right. Next thing I'm going to do is I'm going to have her turn over. So we'll pause the video a sec. All right, we're back. As you notice, I did get a blanket. It's a little bright in here, and I trust my sheet color, but still, this is YouTube. So, all right, so the next thing, same thing, right side. I want to do a few more techniques just for y'all. I like to work on the pectoral muscles. She loves it, as you see in her face. So what I like to do is bring them up here. If they can't go back here, that's another impingement issue. Watch the impingement video. Or just comment below and I'll help you out. So you'll feel a tendon right here. Now she's a little ticklish too. There's a tendon. I like to slide under the tendon and then press into it. You can tell you're on it when they start going, "Aye!" But she's just a little ticklish. And if they are ticklish, you can use a little forearm. And you notice I'm pushing her arm down, giving a little bit of a stretch while pressing in there. This is really good to help release their pectoral muscle. Like I said, she has a lot of rotation on the right side going forward, so we want to strengthen her back. If you like these videos, please subscribe. Follow us on Instagram, Facebook. If you have suggestions, we're open to that too. Now for therapists, I will show one more thing. I don't want, for clients, probably not try this one, but I do want to go under this shoulder blade. Now I don't want to press into the rib cage, but I do want to get on top of this shoulder blade. I don't want to be right into directly into the armpit. Hey, these are fun videos. Might as well get some laughter out of it. So slide under. This helps really release a muscle called your subscapularis. You feeling that?
Yeah.
Yeah. And you notice I'm doing a little bit of passive release. All right. All right. Last I'm going to do is a little bit of neck stretches, and then we will call it on this video. The exercise I would give her is also on one of our videos, corrective exercises on the playlist. We really want to strengthen the back, so get some resistance bands and start doing pulling motions. Hint, hint, I'm trying to tell her to do that. So, like I said, her right side a little bit shortened. Ashlyn's been a therapist almost a year. Got her license last January or February, one of the two. So hold their head up. Put their head on your forearm, right near your elbow. Push down on their pectoral muscle, not on the clavicle, which is also the collarbone. And pull. Push and pull. Usually feels pretty good. Does that feel good? Mm-hmm. Good. For video's sake, we're only doing one side today. So she may feel a little lopsided. But I think this will give y'all some ideas on what y'all can do on each other when you're hurting. If you are hurting and can't get in, try these at home. But also, schedule a massage with us. If you're in the Atascocita, Humble, Kingwood area, we're over here. And we can for sure help you guys out. If you have any suggestions, comment below, like on videos you want to see. We thank you so much for watching these videos. Like I said, if you'd hit the subscribe icon and join our page, we thank you so much and enjoy y'all's day.